Hi, I'm Dr. David Broadway, and today's video will be about breast augmentation. Specifically, we'll be talking about the pros and cons of saline versus gel. We'll talk about the different profiles available in the gel, and I will talk to you about why I like to use the gel in preference to the saline in most cases. This is a saline implant, and you can see that it has a little bubble inside the implant. I did that on purpose to show you that there is a fluid inside of the implant. Saline is salt water, and it's very similar to the body tissues in terms of the chemical makeup. The advantage to a saline implant is that it will allow us to place the implant with a very small incision. This is an empty saline implant, and you can see that it can easily be rolled up, and through a very small incision it can be placed into the breast. Once it's situated in the pocket that we create for the implant, then we use a fill tube, and that's put inside of this valve, and then through this tube we can fill the implant. The advantage of that is that we have a lot of adjustability. The implants have a range of volume that can be placed, and so that does give the surgeon a bit more flexibility. So the advantages of a saline implant is a little bit less expensive. We can use a smaller incision, and there's some flexibility in terms of the size. Okay, well, let me show you a gel implant. This is a high cohesive gel. This particular implant is from Mentor. It's very soft to touch, and you can see how malleable the gel is. Another advantage to the gel implant is that it tends to look and feel more natural than the salines do. These will mimic the natural breast tissue much more so than the saline can. They have a lower risk for failure. They have a lower risk for infection. The disadvantage to them, though, is that I might need a little bit longer incision to get this implant in. I cannot roll this implant up like I can the saline implant when it's empty, and they are a bit more expensive. Despite all these problems, I've been using these since 2002, and they are the most common implant that I use. I think that they are the standard of care today. They were fully approved by the FDA in 2007, and I was able to use them prior to that as a participant in a national study. We have approximately 400 to 500 patients to date with the gel implants, and they have performed very, very well for us. Okay, well, let's talk about implant profiles for a moment. Here you can see with gel implants 3 different profiles. Now, they have the same thing for the saline implants, but they're a bit taller yet. I don't like to use anything but the high profile saline because the lower profiles, in my experience, just have an unacceptable rippling and wrinkling rate. So I rarely, if ever, will use a lower profile saline. The gel implants don't seem to have a significant problem with rippling and wrinkling in comparison with the saline implant. This is a moderate plus, and a high profile implant. All 3 of these are 275 cc's in volume. The moderate implant is a bit wider and not as tall as the high profile implant. And its advantage is that it will look more natural. It'll give us a nicer slope from the clavicle down to the nipple, so you get a smoother transition there. The advantage of a high profile is that it has a narrow base and is taller, and in the same footprint I can give you a lot more volume. The moderate plus profile implant is sort of in between these 2 concepts. Breast augmentations are the most common procedure that I perform. I hope I was able to answer many of your questions. If you have any additional questions, please don't hesitate to give us a call. I look forward to meeting you.